So I was attending the conference here today to talk about lung cancer screening. As a surgeon, I'm very interested in the early detection of lung cancer because we are a central part of not only the detection and diagnosis and staging and therapy of lung cancer. Lung cancer screening is one of the most important advances in cancer care in decades, and I think it's important for us to really make important strides in helping the community develop an awareness and the capacity to detect lung cancer early so we can save lives. So the future is a very exciting thing to think about when it comes to lung cancer care for a variety of reasons. First of all, of course, people are quitting smoking, and smoking is one of the biggest risk factors. So I hope we're going to see a decline in the number of people developing lung cancer. But lung cancer affects non-smokers as well, and it affects former smokers. In fact, most people diagnosed with lung cancer are former smokers. So this is going to be a problem that we will have to deal with for many years to come. And so in that regard, I think there are a lot of important developments on several fronts. First, of course, is lung cancer screening. We now have the ability to detect lung cancer early, and when we can pick it up early, we're much more likely to be able to cure somebody with fairly straightforward, fairly minimal intervention. I'm a surgeon, so of course when I see patients, I have conversations with them about staging lung cancer, diagnosing lung cancer, using all of the tools at our availability to diagnose, stage, and treat them in an efficient manner and in an effective manner so that their cancer is picked up early and they're cured. And then the other exciting developments are on the non-surgical side. Of course, we have a lot of new technology and our surgical skills are getting better and better, but we also have new medications that can help us treat patients with advanced lung cancer and have them survive for much longer and even be cured. And the exciting part is that as a surgeon, I'm now collaborating with our oncologists to treat patients with earlier stage cancer to increase the likelihood of their being cured with our combinations of treatment. Well, I think one of the parts that makes it very exciting for me is that we are part of a system that has a very integrated lung cancer delivery program. And as the surgeon, we feel that we're kind of at the center of that. So when a patient shows up with a lung nodule or a diagnosed lung cancer, it's really important that we are efficient in our approach, that we do the most efficient things to get them to the therapy they need the fastest. So that somebody who has a lung nodule, we recognize that many of those patients don't have lung cancer and they don't necessarily need to have lots of interventions and biopsies and testing. Sometimes they just need reassurance. And as a surgeon who sees a lot of people with lung nodules, I think we're in a unique position to be able to help people understand what needs to get done or maybe what doesn't need to get done. And then to help them to get the appropriate testing, because we can run 10 different tests. And if we don't do them in the right order, then we can delay appropriate therapy or we can subject them to unnecessary risks. Sometimes the appropriate thing to do is a biopsy. Sometimes the appropriate thing to do is to wait. Sometimes the appropriate thing to do is an operation right off the bat. And so being able to work with a team of physicians, oncologists, radiation therapists, pathologists, radiologists, as dedicated surgeons concentrated on treating patients with lung cancer, we're able to bring that efficiency to bear to the benefit of our patients.